Well, good morning, everyone. Tomorrow will be a milestone as we launch the online COVID-19 vaccines. The portal will be live on Monday, March the 15th at 8 a.m. and we'll be accepting appointment bookings at mass immunization clinics across the province, starting with individuals aged 80 and older. I'm going to repeat that, 80 and older. But before it launches, it's critical that everyone in Ontario understands how this portal works. So let me be clear, because this could not be more important. When this launches tomorrow, it is only to book vaccine appointments for those 80 years of age or older. So if you're born in the year of 1941 or earlier, they're the only people or their loved ones booking the appointments for them. So I'll give you an example. If you're going to be 80 this year, if you're going to be 80 in September or October, November, please go online and book your appointment. If you are not 80 or older or helping somebody who is, please do not try to book an appointment. We need to take care of our elderly first. For those who are unable to go online and book an appointment, you can use our 188 number. The number is 888-999-6488. I'll repeat that. That's 888-999-6488. And we're making steady progress in our vaccination delivery plan. To date, we're over 1 million doses. Yesterday, we did over 50,000 doses. We are leading the country, bar none, compared to any other province. And make no mistake about this, we are ready. We are ready. We're ready to ramp up immediately to 150,000 vaccinations a day. We just need more vaccines, I should say. We have the capacity to do 4.8 million in a month, and we have 1.4 million coming in throughout March. So we need more vaccines. Now I'll be ready to take questions.
First of all, there's concerns that the call-in system, the booking system is going to crash just by the volume. Is that going to happen? Has it been tested? Has it been stress tested?
It's been thoroughly tested. Now, we did the trials over the last couple of days. It's been seamless so far. But Jamie, it's absolutely critical. I can't emphasize this enough. It's for anyone that's born in the year 1941 or older. Please do not go online and try to book it if you're not born in 1941 or older, or younger, I should say.
Do we know the capacity of the bookings that are available for the next year?
Well, the capacity, I'll pass it over to the Solicitor General or General. Go ahead, either one.
Premier, thank you. The online system, when it goes on, is two parts. Obviously, the online booking system itself to book a vaccination appointment, and then the customer service desk or the call center where you can also book an appointment if you cannot use the online system itself. We've gone to great lengths on that second part, particularly the customer service desk, the call center, to make sure it is robust. We've got more than 2,200 operators that will be on that center tomorrow, ready to answer calls, somewhere around the capacity of 10,000 calls per hour. When we compare that to what happened in California, in Quebec, and other places, that is twice or 3 times the capacity to handle calls. So we've done the initial work. We're prepared to ramp up even further if necessary, or if the call center doesn't get that many calls, we'll ramp back down when it's appropriate. For the online booking system, we have more than 800,000 appointments that are going to be available in that system. As the Premier said, and I'll say again, for those who are 80 years of age or older, that's what they're reserved for initially. And once we've got them all booked and worked through the system, then we will announce publicly that we'll move to a new age bracket, and we'll ask them to come online and register and also book. But we've got lots of appointments to go. We have stress tested the system over the last weeks here, and including with Toronto Public Health over these past days. And since Friday, we've booked more than 15,000 appointments for Toronto Public Health using the online booking system. It was done without a flaw. we are fairly confident. We are confident in the system itself, but we all know that in many places there are some hiccups, and sometimes the systems go down for a while. And if it does go down for a while, we'll fix it and get it back up. But while it is down, there will not be a single empty chair in a vaccination clinic. The clinics are full out for this next week and a half to 10 days. There will not be a single empty seat as a result of that. Most of the public health units and hospitals have some kind of system themselves, online booking or call centers. That's a great redundancy to have for a week to 2 weeks while we bring the online system in place. And so we've got a capability there to keep the vaccination appointments going, and we've got so many booked already, we won't miss a single one. So if it does have a hiccup, if we do have a bump in the road, our commitment will be that on the other side of the bump, after we fix it, it'll be better than it is on this side of the bump. But a lot of work has gone into this, literally hundreds and hundreds of people making sure it's the best possible system for the people of Ontario. Thank you.
Thank you. And this next few questions are from Laura Stone of the Globe and Mail.
Yep.
I'm up to ask, why is Quebec so much further along in vaccinating seniors in the Montreal area? Should we have focused solely on age from the start?
Well, before I pass this over to the Minister of Health or the Solicitor General, our priority was to make sure that we had long-term care vaccinated, not only the residents there, but the staff. And anyone who wanted a vaccine, especially the first dose, they're done 100%. We're 99% done on the second dose as well, and we have a greater population. We're still out vaccinating Quebec by far, and we're going to continue doing that. So we're on a roll. We're ready. There's no one in the country that has the capacity of 150,000 a day. And I just want to clarify something. For the media, they look at the chart and they see 443,000 in the freezer. I'm going to break that down for you. Out of the 443, AstraZeneca was within that, 160,000. As everyone knows, that's spread out throughout the pharmacies. We have another 160,000 Moderna that arrived yesterday, and that leaves approximately 120,000. Do the math, we're doing about 50,000 a day. So we need more vaccines. Our total capacity in a month is 4.8 million. I'm going to repeat that, 4.8 million. And so far we're seeing about 1.4 million. So we're at about 25% right now of the capacity that we could, that we're capable of doing.
The second question she has, with Solomon McLaughlin,
Yep.
you had an apology,
Yep.
I'm sure you have an open apology to say, but what was said in the phone also?
Well, I just called him up. I like Saul. I've had him in my office before. We get along quite well. Folks, let's keep in mind, we're two political parties. A lot of stuff goes on in the legislature. Sometimes it gets personal. I apologize that I got a little personal there. My job is defend our party, defend my minister when he's not there. But we're going to do, we have an incredible relationship with the Indigenous community. I have an incredible relationship with Chief Roseanne Archibald. I talk to her frequently, and we get along so well, along with all the chiefs, and I get along well with Saul. Things are said, we move forward. I apologized, and let's move forward. And the thing is, with Saul and I, we both want the same thing. We want to make sure the First Nations community, Indigenous community is represented, and we want to make sure everyone gets vaccines. So on that note, we're on the same page, but let's not forget, we're from two separate political parties, and there's a lot of politics that get played day in and day out in the ledge over there. And I like Saul. I'll have him in my office, and we're going to work together to do everything we can for the First Nations community. And I'm going to continue working with Chief Archibald. And I got to give a shout out to Greg Rickford. As I told Saul, I can't think of any other government that has done more for the Indigenous community than this government. We're going to continue doing that. We're going to work side by side with Saul and other folks throughout our province. And I just want to give Greg Rickford a shout out and the Regional Chief Roseanne Archibald. I think the world of her.
Okay, and this comes from Morgan Campbell, Global News. this portal, the provincial portal, the municipalities are already rolling out their own vaccination programs, including family doctors who are contracting eligible patients.
Well, you know, we want to standardize it, but I want to thank all the PHUs that jumped ahead of this and you know, always having a backup. They're doing a great job. And we're just so fortunate that so far, through their support, through the leadership of the PHUs, the hospitals, the paramedics, mobile units, mass vaccination centers, and especially the three people standing behind me. The two ministers and the general, they've shown incredible leadership with the task force, and we're pumping these out. Folks, I'm going to repeat this again. We are ready. We have the infrastructure. We have the people. Now we need the vaccines. It's as simple as that. And I know the federal government's trying. They're doing their best. All I'm just pointing out is we just don't have enough vaccines. Simple as that.
Second question from Marie Campbell is, has the province put its yearly order in for the influenza shots? If so, how much coverage is the province buying for? And will there be enough if more people are going to be vaccinated due to the concerns surrounding the ongoing pandemic?
Yeah, I'm going to pass this to the Minister of Health. I want to give the Minister of Health, you know, a real shout out. Minister Elliott did an incredible job on the last flu shots. We set a record again. 6 million people got their flu shots. So, and that's all due to her leadership. So I'll pass it over to the Minister of Health.
Thank you, Premier. And yes, we have to order the flu shots well in advance. And based on this year's capacity, over 6 million flu shots delivered, we've added a significant extra capacity for next year on the assumption that people are paying attention to this. We had very few cases of flu this year, partly because of people getting the shot, partly because people continuing to follow public health measures. But we anticipate that there will be even more people next year that want to receive the flu shot, and so we've ordered accordingly.
Mr. Health, this question will go to you too. How many how many of today's cases can be attributed to the data error that we were alerted to? And this comes from Jessica Smith-Cross.
Well, there was a data error, and so the cases are higher than, they appear higher than they would normally be due to that reclassification. So we expect that it would be several hundred cases fewer in actual fact, but there was that reclassification that was done.
So what is the accurate number? Because it was quite a jump.
We don't have the accurate number from that. That will be determined later on when we understand exactly the data classification that was done, but we can certainly provide you with that.
Okay, and this is from Janice Golding. I don't know who it would be to, but when do you anticipate you'll be able to move ahead to the next age bracket, 75 age bracket?
Thank you for that question. And as you know, we're starting province-wide tomorrow for 80-plus-year-olds. Almost every single public health unit has already been concurrently with the priorities from phase one, vaccinating 80-plus-year-olds. Some of the public health units don't have their own online booking system or call centers, and that's one of the reasons we needed a provincial system for both things, call center and an online booking system, but also for preparation for things in the future. The province needed that kind of system. Based on the numbers going through, I would simply say somewhere early in April, we will be calling forward 75-year-olds and upwards. Faster if we get more vaccines rolling in and can get them into the arms of people. And as the Premier said several times, and I agree with him, and say also, we've got a machine here that is turning on literally as we speak, with clinics starting in, mass vaccination clinics starting in Toronto this week, more in Peel, in Dufferin, and quite literally right around the province, so that by the end of this coming week, early next week, we'll have more than 100 mass vaccination clinics across the province, plus the pharmacies putting vaccinations through, plus family doctors putting vaccinations through. We can get through the 80-plus-year-olds really quickly. So many have been done already in the long-term care homes, in retirement homes, and also in the communities over this past several weeks. So we're guessing, we're planning for early April, and what we will do as soon as we start to see the capacity in our pipeline greater than the number of 80-year-olds that we have to get vaccines to, we will begin calling forward that next bracket to register and book an appointment. So hopefully early April.
General, this is probably for you too. And this comes from Catherine Ward. What is the plan to vaccinate people in factories and warehouses, those responsible for mail and food and delivery of goods? We are seeing outbreaks occur at these facilities, and most recently at Amazon. Has there been a plan? Are they going to, those people going to be moved up in the priority list, or?
We've got the priority list laid out, as the Government of Ontario has told us to do, for Phase 1 and Phase 2, age plus risk, and slightly down that list are the essential workers of Ontario who look after us, who bring us our food, who look after all the things that keep our society going. And so the plan for them is that they will be included in either mass vaccination clinics or else in pharmacy channels as they roll through, or in some of the public health units, perhaps many, private companies volunteering to set up a mass vaccination clinic in their own factories, using their own occupational health personnel to do the vaccine and look after their workers when their turn comes, perhaps look after the workers plus their families, and perhaps even look after the workers plus their families, plus the people in the neighborhood around when their time comes. So they are would be part of the essential workers, and we have not gotten to them yet, and certainly we're still not even past 80-year-olds yet, and won't be, as I said, till early April. So it'll be a while yet.
The economy is so reliable on, especially people getting food deliveries, and from those, should they not be pushed up, Mr. Premier, in the scale of things? Because Amazon will shut down, which is responsible for water.
So the task force is laid out their priorities, and I agree 100% with the task force. We want to make sure that we take care of the most vulnerable, the most elderly within our province. We've seen long-term care, basically with mortality, has gone down to zero numerous days. You might see the odd one, but it's amazing that now we're down to zero. You look at ICU capacity, every day I look at it, it's roughly about 280-ish, and hospitalization, we're keeping stable, but that doesn't mean we get to go out there and go hog wild. We have to make sure we follow the protocols and be super cautious. But the really good news here, Jamie, is that we are ready. We were just briefed. We get briefed every day. I was just briefed for an hour in there, and I can't begin to tell you how well organized the team is right across the province. And it's not about 4 or 5 people or 10 people. It's about the thousands and thousands of frontline healthcare workers putting the needles into your arms, the pharmacists helping out, putting needles into your arms. The logistics is staggering, and that's why you got to pull me off the ceiling when we try to compare us with small provinces. And I love the provinces, let's say of 1 million or 2 million or 200,000. We are a massive province logistically, equal to Quebec. Quebec's a little larger, but we have double the amount of people, double the amount of seniors, pretty well double on all fronts. And the logistics is just unbelievable. They've done an incredible job, absolutely incredible job over the last few weeks. There's one thing. As I keep saying, we need vaccines. And there, again, the federal government's working hard. They're doing everything we can. But again, the numbers, 1.4 million we have capacity of 4.8 million. And so we need to get it, and we'll start ramping it up. But it's a well-organized machine, and we are ready, 100% ready.
And this is the last question. It comes from Manuel Vega, and it's repeated by Cynthia Mulligan. First part is seniors with red and white, the old-fashioned OHIP cards, which were supposed to be a decade ago. They're having problems booking online. Is there an alternative for them, and how can they book if they have the red and white? And the other thing is, we're also making the same question, but a lot of seniors are visibly seeing what they perceive as line jumping. So when the person becomes compromised, how do you tell the difference between a person that says they might have they have sensitive to allergies and therefore they need it, as opposed to a person that's is in the process of chemo? How are you going to separate those people?
Well, I'm going to pass this over to the Minister of Health, but anyone going online, I'm going to repeat this number again. It's 888-999-6488. That's 888-999-6488. Call has a capacity of 87,000. As the General was saying, You know, I'm sure these lines are going to get tied up, but let's put this into perspective. California has 40 million people. They had 1,000 agents. We have close to 15 million people. We have 2,200. Quebec has 8.5 million people. They have 600 agents. So we have ramped up on all fronts, all fronts. I'll pass it over to Minister of Health.
Well, people that have a red and white card cannot book online, but they can certainly call the customer service line and they can book through that. So there shouldn't be any concerns about people with the old red and white card making sure that they can get an appointment. It will have to be done over the phone. With respect to the issue of people queue jumping because of physical conditions, we anticipate that most people that have significant physical conditions will be contacted by their family doctor through primary care, and that they will then be able to go into their physician's office or nurse practitioners, whatever it happens to be, to receive their vaccine. And that should significantly cut down on any allegations of queue jumping, because we want people who are in line that are of the age of 80 or older to be able to get there and get in first, because we know that age is the greatest risk factor, and that's what we're concentrating on now with our system that is fully ready to go. Thank you.
That's great. Thanks, everyone.